The first population were those patients that were defined by a BRCA mutation. And in this study, we were able to evaluate both germline and tissue-based or somatic mutations in BRCA, and that comprised one whole group. And that was, about 200 patients. We have a second group that we called HRD, homologous recombination deficient, and this included those 200 patients that were BRCA positive or carried a BRCA mutation or had one in the tumor, because those are essentially homologous recombination deficient. But then we added the patients that were wild type for BRCA but had homologous recombination deficiency, and we did that through an assessment of an assay assessing for HRD. And that was about 421 patients total. And then the third inclusive patient population is the entire patient population, and that totaled 757 patients. So the primary endpoint was to look at progression-free survival in the combination arm with veliparib be given throughout versus the placebo arm. And what we found was that in each of those patient cohort groups, the addition of veliparib improved the progression-free survival significantly. And what we found was that the effect was strongest in the BRCA population, as we kind of expected, and the reduction in the hazard for progression or death was about 56%. What's really unique about this study, and I think it's important to understand about this study versus all the other trials that have been done so far, is that this particular trial randomized the patients at the beginning of their chemotherapy from their initiation of their post-surgical treatment, or in the case of our study, also a neoadjuvant. So that's unique because all of the other trials that have been done to date, including Solo 1, Paola 1, and Prima, have all looked at just the maintenance phase. So patients were defined by their response to induction therapy. And what's different about this trial is that we did not make that assumption. We used all comers, and we calculated the progression-free survival from that point on.